Now, the Mental Health Authority is embarking on an exercise to rescue mental health patients who are being subjected to inhumane treatment at prayer camps and other traditional healing centers across the country. Now, one such exercise at the prayer camp in Nyankomanse Ahinkro in the central region has led to the rescue of 16 mental health patients, now some of whom have been chained for 7 years. Our Central Regional Correspondent, Rachel Kodonyako, has more in the following report.
Ghana's treatment of mental disability, according to the Human Rights Watch, is in violation of numerous domestic and international laws and agreements. Also, Ghana's constitution forbids treatments that detract from a person's dignity and worth as a human being. It is in furtherance of this that today the Mental Health Authority has taken a step aimed at protecting the human rights of people that are mentally challenged but find themselves in prayer camps. These people have unfortunately been chained for ages and are preyed upon by scorpions and snakes, but they remain helpless because their movement have been restricted. Prayer camps and other faith-based healers are scattered all over Ghana, where people who are mentally challenged are involuntarily chained to trees, forced to fast, and receive minimal treatments. Most Ghanaians with mental health concerns based on their religious and other superstitious beliefs easily turn to the hundreds of prayer camps.
How? This is how they say I'm crazy. So me, I'm frank and free. I don't have a father. My father has passed away. Mori, please, this is not the first time. Oh. You know, my wife is from Mori. I'm a stranger. I've worked, and my mother is from a building at Mori Johnson, which he has passed away. And my father.
Oh, it's okay, it's okay. The chief psychiatrist, Dr. Akwesi Osei, who led the operation, the first step in implementing what the Act says, is warning prayer camps across the country to desist from the practice as it stands against the acts that protect people with mental health concerns.
You believe it's your illness is spiritually caused, no problem, continue praying, but it has manifested physically on earth here. So that aspect, we can deal with it. So you take you there, you go and handle that aspect, and you continue with your prayers. So you don't have any difficulty with that. But for you to decide that, just with the cutlass analogy, no, this one is cutlass, somebody calls it, and therefore I'll let it be there, and the wound is getting infected and chopping up the whole hand, we can't allow that. So what we're doing is that for these 16 we are releasing from the chains now, we are going to take care of them fully. Transportation to Ankafo, their medication, their admission fee, their diet, everything, we are taking full care. Thereafter, let's say from tomorrow somebody decides to bring his relative here, he will take care of that. And we are saying that if you bring anybody here, and that person needs to be restrained or to be put in chains. Since we've told the prayer camp that they can't put the person in chains, they will need to refer you. So if they are referring you and you bring the person to Ankafo, then you bear the cost.
These patients who have been unchained have been sent to the Ankafo Psychiatric Hospital. But Dr. Osei says if the act can be implemented, government should look at the funding difficulties of the psychiatric institutions in the country. According to him, it is an embarrassment for people to be continually chained when the act clearly frowns on it because government is starving the psychiatric institutions.
We want to use this medium to urge the government again. If the government itself feels embarrassed by our human rights abuse, then they should help us to be able to continue this program. And that means they should give us the resources, the funding. Otherwise, time may come, we cannot continue. And this is serious blot on our collective conscience as a nation. 2012 Human Rights Report internationally was centered on Ghana, and they described our situation as like a death sentence to have mental illness. I thought it was a serious embarrassment, and we should all regard it as a serious embarrassment. The government should feel seriously indicted. Embarrassment to us, but primarily embarrassment to the government. And the government should not want to see itself in that situation again. If they don't want to see themselves in that situation, then they should give us all the resources. As we are talking, we are in June, getting to July. We've not had a single peso from the government. We have not had a peso from the government. The airline which should be passed so that we can have funding, the government is not passing it. And this, I must single out the Ministry of Finance, which is the culprit in this matter. Ministry of Finance should put in place the levy so Parliament can pass it. Parliament is ready to pass the airline, but the levy is not there, and that is at the doorsteps of the Ministry of Finance. So I want to use this medium to say that the Ministry of Finance stands indicted
The joy and excitement on the faces of the patients that have been freed and being sent to the Anchor 4 Psychiatric Hospital knows no bounds. Richard Kwejonyako, Joy News, Cape Coast.
Well, for professionals in the mental health sector, their patients and care needs seem to be forgotten by the stakeholders. It's a neglected area generally. Their pleas for assistance, they say, are mostly not adhered to, with very little aid coming in. They will not mince words in stating the continuous delay of subventions from the government has greatly affected their work output. And we had the chief psychiatrist there say exactly just that, sometimes forcing them to discharge patients to go home, though they've not been fully recovered. Now, that's why an organization that, in an NGO, a Christian-based NGO, Life Developers Movement, they've taken initiative today to supply, make a donation to the Christ Psychiatric Hospital to aid in the work that they do there. The items include bales of fabric, the sewing machines with its accessories, and a cash of 2,000 cedi springs. Atoke is the vice president of the NGO.
We realized that the occupational therapy unit was in a very deplorable state, and so it's really touched our heart, and then we decided in our own little way to do something to support the unit. And so we started mobilizing funds somewhere middle of this year, and then God being so good, we have been able to get support from various individuals, and some individuals in Ghana and then outside Ghana as well. And this is what we are seeing here today. We've been able to purchase some few items, sewing machines and some clothes and other things that the occupational therapy unit will need in the process of working. And this is not just going to be the end, but we are hoping that going into the future, we will be able to do more. And also we are using this medium to plead to the Ghanaians out there to not stigmatize and discriminate against individuals with mental illness. But most of them here are not here by choice. It's as a result of some reasons that they are here. Mental illness is just like any other disease that you can think about. So we don't need to stigmatize and discriminate against individuals with mental illness. And so we are pleading with the general public that anytime we come knocking at their doorstep to support the mental health activities, they should try and then support this.
Well, receiving the items, a nurse at the facility, Emmanuel Fabiri, promised the items will be put to good use.
Most grateful. In fact, when it comes to occupational therapy department, normally it's supposed to be a means that will help the patient going forward. So when the person is discharged from the ward, he or she doesn't become a burden to the society. Because what we do see is our patients after discharge, what happens next? They go to the house, relatives are not catering for them. The society is already neglecting them because when they are coming back, it's a sort of burden to them. The person is unemployed. So what happened to this individual? But once the OT department is put in a good shape, as they're on the ward receiving treatment, they also come here so to learn some kind of trade, and it's going to help them. So one, they're going to be beneficial to themselves, to the society, and Ghana as a whole. So there wouldn't be any burden. So the issue about mental health always needing funds wouldn't be a one-day thing. Because the person comes and is able to be productive, all of us will benefit. So seeing items like these sewing machines and the knitting, probably the general public can now come here. When you're coming to Accra Psychiatric, you are not just coming because of a patient also. You also can also walk in here. Come and get the best of clothing that you can get somewhere at affordable prices. So we can assure you that we'll get the patient. You've seen some of them around. They are going to get most of them here to start work immediately. So the next time you come, you see that the machines that you gave to us wasn't something that we just abandon and place it somewhere. We are going to make good use of it, and we ensure it goes to the benefit of the patients.
So we had Mr. Fabiri Emmanuel with the Accra Psychiatric Hospital. I've just been joined in the studio by two reps of the association. I'll allow them to introduce themselves. The Vice President.
Anita Paddy.
Anita Paddy.
Emmanuel Fabiri.
Oh, so you're the man we just had. It didn't look
sure.
like you in the shot that we just played there, but thank you for joining us. So you were with the psychiatric hospital?
Yes.
Okay, let me start from you first. What did you see when you went there? Because most people who go to psychiatric hospital are shocked by what they see. What did you see?
Actually, this is not our first time being to the Accra Psychiatric.
This is not your first time?
This is not our first time. This is the second major donation.
Have you seen improvement since your last visit?
Yes,
okay.
I think so. Because initially, the first time was last year around September, where we donated to the hospital, the whole hospital generally, especially to the wards, some detergents, some soaps, some other things to help the patients and to help in the upkeeping of the place. And we realized that the occupational therapy unit is in a way dead. But as he rightly said, this is supposed to occupy the inmates, the patients there, so that their stay there doesn't become something routine. Medicine, sleep, walkabouts, at least they should be engaged. So something small to get them active, and before they come back to society, they can be well integrated. So we took it upon ourselves that, okay, why then don't we ask them about the units, what they need to bring it back to life, to revive it. We're given a list, and we decided to go public, adverts on social media, everywhere possible, and including the international market. So we went as far as United States of America, and we thank Dr. Jemima Kankam very much, because she's really been of help. So she helped us raise funds as much as 7,000 cedis to get these items for them, hoping that at least it will bring back life to the unit.
Emmanuel, just before we talked about the donation today, we played a report, and your former boss was speaking, talking about lack of resources for mental health generally, even for the authority. Now he's moved on from the psychiatric hospital. He's not at the mental health authority, where you think that finally he will get some resources to work. He says the resources are lacking. Give us a sense of how this is affecting your work.
Evans, the point is, with mental health in general, I think for a long time it's been a neglected field. That is where basic logistics that you need to work with are not coming as expected. And even with the funding, as our own CEO, Dr. Kwesi, was saying, it's been of a major challenge. To the extent of last year, if you could recall, getting the latter part of the year, the nurses and the staff in the hospital have to actually leave for their own safety, because basic things like detergents were not even there for you to work with, and the medications, the food that they need, and there was not some risk allowance for the workers who are in there. So the situation is not as we expect it to be, and we are hoping that going forward, the powers that be will ensure that we get those funds running. Because when it comes to mental health, it's not something that is far from us. Any of us can suffer from it.
Absolutely.
But that's something that normally we do forget about it. We think, after all, it's not me, it's not my family. But don't forget that that man you see in the street, if you're in a car, that man can start, doing something that can affect you, which, of course, the person is not your family member. But in a way, you came across or you met him, and anything can happen to you. So it's time that we take a critical look at what actually is happening.
With all that is happening at the psychiatric hospitals, not only your place, but the others, we saw videos of people who have been chained to trees at prayer camps and, traditional healers, etc., because families believe that it's a spiritual aspect to mental health, which is what your boss is trying to deal with now. What do you say about what we just saw? What's your comment on what we just saw? I mean, is that happening? How rampant and predominant is that?
Yes. In fact, when some of the cases that come to an end, some get to a stage where it has deteriorated that it's a bit of a difficulty when you need to treat it. Because when the relatives start seeing those signs, instead of first going to the nearest health facility, they tend to believe that it's some form of spirituality. So then what do we do? First point of call, let's go and see some fetish priest somewhere or some man of God somewhere for him or her to pray for us. And that's where they start from, and which is not the best. As Africans, yes, we all know, we all have our forms of spiritual whatever that we do believe in. But what we are saying is, you know what, you can bring this person for treatment and as well go ahead and pray. Because if you serve God, for instance, he's not at one place, but the health facility or the workers, we are hoping, we are now trying to see that we can get them in the communities. But they are not everywhere. But there are certain places that you can go. You can go to hospitals for them to be treated. So take the person there for him or her to be treated. Once you go ahead with your prayers, but you don't send the person to a prayer camp where he'll be chained somewhere, will be in the rain. Imagine we are in June, July. There's somebody in a prayer camp or with a fetish place somewhere who is being beaten by the rain.
Yeah, I mean, from what we saw, they're chained on the trees. As you can see, this one on the screen, for example, it's run under a tree there and sitting on the mat. That tells you that this individual is open to the vagaries of the weather, sitting there every day. Let me bring you in because you are a faith-based NGO, so you understand this as well as the practical part. Prayer works, right? But from what you see, people are doing this because of what they believe could be an answer to the problem of mental health, which is praying. And so take them to a camp and chain them to a tree and pray for them. What do you say to that? Because you, instead of doing that, you going to a prayer camp and praying for them, you decided to buy materials and go and donate to the mental health institution.
Yes, because I think till date, we see mental health as a spiritual, like he said, something spiritual. Well, because of how people who suffer from mental health may behave. You know, when there's some mental illness or ill health somewhere, your thinking, your behavior, everything changes. And in a way, it's classified as bizarre, something out from the norm. So we think maybe it's a witchcraft attack. It's something because this person, everybody is asleep. This person is walking about, hey, you are a witch, you are this, you are that. So let's then take you to my pastor, my this, my prophet. And it takes us back to the dark ages when you are studying mental health. During those times, the 80s, the 18s, thereabout, they believe that when you are suffering from mental health, it's as a result of a punishment from the gods. And so they were engaging in this trephination where they will cut some part of your head. A whole lot of things were going on. And to date, we believe that mental health issues are different from physical health conditions. But we want the public to understand that for every physical ill health, there is some mental issues underpinning it. Because no one suffers from malaria, hypertension, diabetes, without being depressed, without being in a form of distress. And when all these things happen, it means that your health itself is not complete, because WHO defines health as a complete state of well-being and not an absence of infirmity. So the fact that right now I can walk, I can go about normal, doesn't mean that I'm healthy. You see, we are not really getting what it means to say I'm healthy. Is a package. It's a package: physical, mental, social well-being. If you are easily angered, if you cannot mingle with people, if you are always antisocial, as we call them, you have issues and you are not well. But we have not come to understand that part of health, so that we are always almost tilting towards the physical well-being. If there is no physical signs to show I'm not well, then it means I'm okay.
Final word to you, Emmanuel. So this tends to be what happens. Every now and then somebody come and donate something to you. But that cannot be sustainable, because if the system, the health system, doesn't have a proper sustainable way of channeling resources to you, and you have to live off donations and goodwill of ordinary people, it's always a challenge. We have a new administration in place, a new head ministry, etc., etc. Going forward, have you seen anything to give you hope that the challenge that you face maybe is on the brink of being addressed in a very sustainable manner?
Yes, I must say we are most grateful to Ghanaians who actually work in, like you said, to come and help us. Had it not been them, I don't know where we would have got into, but for how long. But when Life Development Movement, for instance, came in, they just didn't bring us food. That would be just one day thing. They actually bought us with machines that we can start training some of our patients in there so they can be beneficial. But going forward, management have put in some projects that can also help in sustaining us. As I speak to you now, we had some fundraising dinner to get some resources as well, so we can purchase some few machines that we can also start running. So based on that, we can get some funds to help us going forward in case the money that we expect from government is not coming and the donations are also not coming as it is. So management are putting in place measures to ensure that these things do come in. And just last week we had the vice president, that is Dr. Baumia, coming over to our facility to have a first-hand info as to what actually pertains on the ground. And there's been some assurance. So we are hoping that it's not be one of those things where they do come and pass through and they go. We are hoping that going forward, at least things can change a bit so we can get the needed funds to be able to give them that quality of treatment that they require.
Thank you all for joining us here on The Pulse. So The Pulse here on the JoyNews channel. My name is Evans Mensah. We'll move on to some other issues, though, dominating the headlines today. The minority in Parliament is warning district assemblies will struggle to roll out development projects this year as a result of reduced allocations to them. Parliament this week approved the formula for the distribution of funds under the DAFC, the District Assembly Common Fund. And there has been a cut in the allocation of about 200 million cedis this year compared to last year. Member of Parliament Finance Committee Benjamin Bodo says this is not good enough.
As a result of the bill submitted by the Ministry of Finance to cap earmarked funds, this Assembly's Common Fund was also affected. In the previous regime, even from President Kufuor's time, the allocation of funds to the District Assembly's Common Fund was pegged at 7.5% of revenue. There is already dispute about what that revenue means from the Constitution. But for now, the definition boils it down to tax revenue. So the allocation had been 7.5%, but as a result of the earmarking of funds, this has reduced the amount to the barest minimum recommended by the Constitution, Article 252 of our Constitution, which says that 5% of, minimum of 5% of total revenue should be allocated to the districts for development projects. So as a result of this, the amount dropped from over 2 billion from last year to 1.575 billion this year.
Now imagine living in 21st century Ghana without electricity. That is the plight of more than 1,500 residents at Dodukrom in the eastern region. According to traditional leaders there, all efforts to draw the attention of government to their plight have proved futile. Now the result, public workers posted there are refusing to work. Joseph Opoku-Gapo was in the community and came through with this report.
Dodukrom is one of the oldest communities in the Ayinswa North district of the eastern region. It's a farming community with residents growing mainly cocoa and maize. For residents here, their biggest headache is that more than 60 years after the construction of the Akosombo Dam, they are yet to see electricity, leaving them disappointed in political authority. Ochameng Bedu is the chief linguist in the community.
We have been
looking forward to light since the time of former President Rawlings. We have been made to pay lots of money for this, but we still don't have light. Doctors and other health workers refuse posting here because they can't even own a fridge to keep their food.
For the Queen Mother here, Ohima Buche, the plight of school children, with them being unable to learn at night, is a problem that requires urgent attention. She feels Dodukrom has been neglected because all nearby communities have benefited from electricity extension over the last few years.
We have JHS and even a clinic here, but children are unable to learn at night, thereby affecting their education. We plead with government to intervene as soon as possible and help extend lights here.
A resident, Isaac Opare, is worried the community has not developed socio-economically over the years as a result of the absence of electricity.
Most of the teachers live in nearby communities. Sometimes they don't come to work, so it makes life difficult for us. In fact, the general development of the community has been negatively affected as a result of the absence of electricity. We want government to help us.
Their plea is simple. They are calling for an immediate intervention by the Rural Electrification Project so that electricity is extended there. For JoyNews, Joseph Opoku Gakpo reporting.